I'm Ravi Hirekatur. I'm one of the integrative medicine physicians at UW Osher Center Integrative Health Program. I'm going to lead or demonstrate a very common breathing meditation from Vipassana tradition, which is also called mindfulness meditation. This comes from Buddhist tradition. The two sources of focus in Vipassana, one is the breath, because breath is always there. It's hard to miss it. And the other one is body sensations. So here I would like to focus on the breath. So breath, there are many ways to do it. I'm going to show just one way of using the breath as a vehicle to meditate. The mindfulness meditation, as many of you know, it is non-judgmental awareness of what is happening in the body. So this process brings one to the present moment. Oftentimes we are thinking about the future, thinking about the past, but not in the present. So this will bring us to the present moment. And this does not involve any specific types of breathing. So we don't need to do any special breathing. We're just breathing normally, and then we are focusing on the in-breath as well as out-breath. And one caution here, anybody that has some anxiety about breathing, I would say, I'll later discuss another way of using breath as a vehicle, but a different way. So here we're just focusing on the breath. The first, sit yourself in a comfortable position with the spine erect and with your feet touching the ground and feeling the body on the chair, the points of contact. And imagine as though a string tied to the top of your head, pulling it upward. So now stretch up and then settle in without bending your back. When you're settling in, you feel comfortable, and then shoulders slightly stretched out to the back, and then the chin slightly tucked in. So that keeps the body straight. In case if you fall asleep, it prevents you from crashing down. If the spine is straight, you can only go this way or that way, or this way or this way, but you're not going to bend your back and crash your forehead into the ground. So that posture keeps you stable. So now I'm going to start with this. As you breathe in, just become aware of your breath. Have some curiosity about your breath. What happens when you breathe in, out? We rarely pay attention to what is happening to breath while breathing in or out. As we breathe in, just feel the cooler air entering the nostrils, brushing against the nostrils. As it enters the nostrils, it will brush against the mucous membranes in the nose. And then one can feel it go through the nasal passages into the throat. So feel all those sensations. Breathing in, feel the air brushing against the nostril, cooler air brushing against the mucous membranes, going into your throat. And as you breathe out, notice the warm breath going out. Again, brushing against the nostrils. At the next breath in, feel the air coming through the nostrils. In breath, cooler. As you breathe out, feel the warm air going out through the nostrils. If you find that your mind is wandering, thinking about things, gently let go of that and bring your awareness back to your breath. Breathe in, feel the air going through the nostrils and the nasal passages. Breathe out, feel the warm air going through the nostrils and nasal passages. I'm going to add one more level of observation here. As you breathe in, because of the vacuum effect, the nostrils are slightly pulled in. This is a very, very subtle feeling of sensation of nostrils being pulled in. If you are able to observe it, as you breathe in, feel the nostrils pulled in, feel the cool air brushing past the nostrils and the nasal passages. And as you breathe out, the nostrils flare out slightly against the warm air. So as you breathe in, feel the cool air going through the nostrils, brushing against the nasal passages, and nostrils being slightly pulled in. And as you breathe out, nostrils slightly flaring out, feel the warm air brushing against the nasal passages. And there's no effort here. This is effortless. Breathe as though you breathe naturally, normally. And if you find your mind wandering again, just simply let go of it. Bring it back. Just going to introduce one more level of observation. Again, it's optional. Some people may find it very relaxing. Some people may find it difficult to do it. As you breathe in and out, there is a point between in-breath and out-breath where there's nothing is moving. In-breath stops, out-breath hasn't begun. It's a pause. Stop. Everything stops. So if you're able to put your attention on that little brief pause, that has a lot of value in terms of inducing calmness and peace. So breathe in, feel the warm air, cool air going in, nostrils being pulled in, and a little pause, feel that. And then as you breathe out, you feel the warm air going out, nostrils flaring out. And before you breathe in, there's a little pause. But if you can't find that little pause, just let go of it. There is no effort involved here. Just spontaneous, as it is happening, as you're breathing. Couple of more breaths. Feel the air moving in, cool air, nostrils pulled in, and then the pause as you breathe out. Feel the warm air, nostrils flaring out, and then a pause. And see how you feel when you experience that pause. So when you're ready, you can gently focus your awareness on your body, feeling the points of contact on the chair, on the floor. Become aware of the sounds outside. Know that you're sitting on a chair or a cushion in a room, surroundings with sounds. Gradually open your eyes when you're ready. So a couple of points here. Some people may have difficulty focusing on their breath. It may make them anxious if they have any respiratory difficulties, respiratory issues. Or some people are known to put extra effort into breathing when they try to focus their attention. When they're normally breathing, they're not putting any effort. But again, when you ask them to focus their attention on the breath, then there may be extra effort. If that happens, then there is another way of doing that. So another way to focus on the breath is focus on your abdomen. As you're breathing in, abdomen sticks out. As you breathe out, abdomen goes in. The focus on the movement of the abdomen, in and out. Again, there's a pause between the two before the abdomen changes direction. And that is an important point. There's a lot of value there. Again, if somebody has trouble focusing on the breath, then this would be a good way to do it. So I hope you'll be able to learn this and enjoy the calmness and the tranquility that comes with this practice.